I mean, I've had patients go to bachelor parties the night of the procedure till 5 in the morning, one guy.
Oh my.
And they can go back to work sometimes the next day. This is what people want, but he didn't miss a beat.
Most people think getting a hair transplant means shaving your head and hiding out for weeks. But with the right technique, you can restore your hair discreetly without disrupting your life. In this video, I'm joined by Dr. Matt Goldstein, my associate and medical partner in our practice, for a candid conversation about a procedure we both perform pretty much on a daily basis, Shave-less FUE. If you've been holding back from taking action because of privacy concerns or fear of downtime, you'll want to watch this. We're going to reveal how the procedure works, who it's best for, what most people get wrong about it, and how it compares to other techniques. Let's get into it.
Well, let's talk about the basics. You know, people ask, what is shaveless FUE?
You know, our patients have the opportunity to choose between a shaved procedure versus a shaveless FUE procedure. About half, would you say, of our patients opt for the FUE?
I mean, last year, actually, the numbers were 70% shaveless.
Wow.
Yeah.
Wow.
And I mean, that's really unusual for hair restoration because usually like shaveless is like a really big deal and,
Yeah.
you know, oh my gosh, and they kind of overcharge and kind of made it affordable.
Yeah. Yeah. I think shaveless FUE is really what most patients want going forward. A little more privacy and
Yeah, no, concealment's king.
yeah.
I mean, you know, I think when it comes down to like, I'm a patient, I'm thinking of hair transplant, you have to really consider shaveless as a viable option. I mean, there are a lot of naysayers on the web saying, oh, you know, the grafts aren't as good, or it's too hard, or you can't do as many grafts. Well, that's just not true with our team and our approach. And so we can make it happen. I mean, you've seen
Oh yeah.
countless patients where we've done this, and I mean, what's her thought when they're done?
At the end of the day, after undergoing the procedure and their hair remains long
Yeah,
and you can't see any signs of any surgical interventions,
yeah.
you know, they walk out of here at the end of the day, you wouldn't know they had anything done.
This week we had a patient that said, I had like kind of low expectations about this. I kind of built into my schedule, like, I think my hair is probably going to be jacked up when I leave. And I mean, we worked on his frontal hairline. You could see where the grafts are, but he had enough hair to maybe comb it forward to conceal it. But I mean, he was absolutely blown away by the, you know, the donor site, because it literally looked the same as when he walked in. And that's not easy to do.
Exactly. A lot of patients, like you said, take time off.
Yeah.
We hear about people having trips to the beach just so they're not around their friends and coworkers because they're concerned what they might look like. And,
Sure.
And then they walk out of here saying, it's really not necessary.
Oh,
I can go to work tomorrow.
Yeah. You know, I think in talking with kind of doctors in the industry at different conferences and stuff, and I think there's somewhat of an attitude like, you're getting a big procedure, you're just going to have to deal with it. Almost like getting an ACL where you're going to be out and you're going to have to go through a ton of rehab. You know, back in 2013, when I first started doing shaveless, I recognized like, this is what people want. And when you come through and they can go back to work sometimes the next day. I mean, I've had patients go to bachelor parties the night of the procedure till 5 in the morning, one guy.
Oh my.
And I had a patient recently went to a country concert. You remember him?
Yeah, yeah.
And he just wore a baseball cap, but he had longer hair in the back, and it looked like nothing happened.
Yeah,
And,
yeah.
you know, so he didn't miss a beat. That's kind of what the shaveless is all about. I mean, obviously it's a little bit more expensive and not a lot, but if you look at the cost savings of actually going back to work early in like a day or days versus a week or weeks, and not having a weird haircut, I mean, the extra cost to do the shaveless, and you know, there is an extra cost because it's not easy. I mean, you can go into that. I mean,
it's more work on our end.
Absolutely, yeah. And I think it's really why a lot of practices don't do it, you know?
Yeah, I'm always amazed how many times patients tell me that they've called around and a lot of practices will turn them away saying they simply don't do a shaveless FUE.
Yeah.
And then they come and they find us.
Yeah.
And having the opportunity to have the shaveless FUE, they're like, this is what I want.
Yeah. Yeah, back in the day, kind of when I first started doing shaveless, it was the worst for me. I mean, it was so painstaking. I mean, I literally took fine surgical scissors and just individually cut hairs that I was going to take. And try doing that 2,000 times if you're doing 2,000 grafts. And kind of what generally happened is you would actually cut more hair than you would take.
Uh-huh.
So the donor site looked thinner than it should. You know what I mean? It was almost like we harvested 4,000 instead of 2,000. And so it was about 2013-ish, 2014 that I started the technique that we do now, where we just cut and core the hair. There's a little technique, flicking the wrist, and the grafts are just the same as doing a shaveless. But because we're not cutting any other hairs, and you're only taking a normal percentage,
Mm-hmm.
in that range, the donor site looks the same.
Yeah,
Yeah.
absolutely. When you're taking those grafts, you're visually inspecting them, and for anybody to make the claim that the grafts are not as good as
Yeah.
if you did a shaved case,
Oh,
that's
yeah.
that's just not true.
It's not true. Yeah. I think a lot of the naysayers, and we see this with like beard and body hair, where practices don't offer that as a service, and we do it frequently. They say, "Oh, the beard hair and the chest hair doesn't take." It's like, that's not true. Not true at all.
No.
Yeah. Or the shaveless grafts are going to be so bad, you're going to have really bad results. And, I think it's kind of bogus advice, a lot of that is coming from people that aren't even physicians doing the case. They're salesmen
Right.
or saleswomen,
Mm-hmm.
doing the assessment. And
Yeah,
with our consultations, what it takes, you have big conversations.
sure. Yeah,
Yeah.
they're giving them bad and inaccurate advice.
Yeah.
And they should just call it for what it is. If they don't want to do the procedure or aren't trained to do the procedure,
Yeah.
say so. But to mislead a patient is just unethical.
A lot of it depends on us as physician providers actually being in the case. But I mean, talk about our team. I mean,
Right?
you think of the 4 steps we have to do to get this done.
Well, for each graft, you have to core the graft. So we're using a device that cores a circular incision around the graft, a little smaller than a millimeter.
Yep.
Then we come in with the 4 steps and we lift the graft and remove it.
Yep.
And we store it in a nutrient-rich solution.
Yep.
And then coming back, you take each graft and we load it into our implanter pens,
Yep.
which requires high magnification loops.
Yep.
And then the 4th step is to actually take those implanter pens and place the grafts. So that's 4 steps for each graft. 2,000 grafts is 8,000 steps.
Yep. So, if you think of 2,000 times 4, that's 8,000, basically technical procedures that have to be done for a 2,000 graft procedure. And then if you kind of multiply all that by, we'll say a second, you know what I mean?
Mm-hmm.
If you add components to the case that actually could extend that time, it actually becomes exponential. We worked so hard. I mean, every day we're talking about positioning, moving people around. It can be musical chairs because, we're harvesting above while somebody's pulling below, and then we switch.
Yes.
And keeping the case moving at the same time, loading and placing grafts. So grafts are going out and going back in.
Mm-hmm.
So we've taken these really long technical shaveless procedures, and I mean, you've seen it as low as 4.5, 5 hours max for a 2,000 graft case.
And we had a very big case this week.
Yeah.
Where a gentleman had to catch a flight.
Yep.
An early flight.
Oh, yeah.
And we did.
It was at 4:30. We started at about 8.
Yeah.
Yeah.
2,500 graft count.
Yep. Yeah.
I weighed him out the door before 3. But that's the efficiency.
We were done at 2:20.
Yeah.
Yep.
That was impressive.
And that was with taking lunch and doing breaks. But again, it's a team approach. I think it's unmatched, to be honest with you. I've talked to enough doctors and been through enough research on the web to know what other places, other practices are doing. And because, we have the 2 of us as providers, and many times, we work together in cases.
Sure.
We've got 2 physician's assistants that have each placed well over 1 million grafts and also extracted that much.
Mm-hmm.
And they're extremely experienced, I think more than most physicians could ever attain,
Right.
you know.
We have times when there's 4 of us in the room at the same time working on the patient,
Oh,
both
yeah.
extracting grafts and
Mhm.
placing grafts, and like
Yeah.
you said, maximizing our efficiency.
Oh, yeah.
I think most of our patients are really wowed by that.
Oh, yeah. Because, you know, in Georgia, it is actually illegal for a non-licensed technician to extract or place grafts because surgery is the extraction and manipulation of human tissue.
Mm-hmm.
And hair restoration surgery falls into that. I've done a deep dive and looked at the regulations, and hair restoration is termed a surgery and specifically says no non-providers other than physician, a physician assisted, a physician assistant PA
Mm-hmm.
under the direction of a doctor, or a nurse practitioner under the direction of the doctor can do extractions or placements. So, but our medical assistants, I mean, they're pulling grafts, and that's really hard. I mean, you can talk about this doing a shaveless and finding these grafts.
Yeah, yeah. I mean, that's one of the most difficult tasks in a shaveless case is going through patients' longer hair and finding those grafts and pulling them.
Yeah.
And our MAs are very, very skilled. That
Oh, yeah.
I know we tend to help them with that task from time to time, and I'm always amazed that they can do it with such ease and precision,
Oh,
so much
yeah.
faster than I know I can.
Oh, absolutely. And I think when we do that, we have 4 things to do: core, pull, load, place. If we can do those simultaneously and have the right positioning, and it means we're moving, so we can all work together. That's when maximal efficiency is obtained. The fact that we're doing 2,000, I think my record 2,000 shaveless ever has been about 4 hours.
Wow.
Yeah.
Wow.
And that was
From 10 hours down to 4.
Yep, it was to a crown, so we're able to easily kind of place, as we're extracting.
Mm-hmm.
Even frontal hairlines is 4.5, 5 hours. And again, this is with all good variables. Sometimes you just can't go that fast.
Right.
Yeah, and
Right.
that's a different conversation. But I think the doctors that kind of cut and run, and have the technicians take over,
Mm-hmm.
they're not going to be part of the follow-up because the patient knows they weren't part of the case. And we've seen enough patients that have had procedures at other places, and I mean, they're not happy.
Yeah, they're
Yeah.
not happy, and they realize that a physician wasn't hands-on in the
Yeah.
case, and they come to us to
Yeah.
to fix their situation.
Oh, yeah. So I think, from a shaveless perspective, I mean, the ultimate decision is going to be the patient. It's not my decision.
Right.
I think some patients that might not be a great candidate because the length of hair does matter with shaveless.
Mm-hmm.
I can do, and we can do shaveless on any patient, at any hair length except super ultra short. I would say, just do a medium fade
Mm-hmm.
and call it shaves.
Yes.
You're going to
Yes.
save a little bit of money in doing the procedure, and it's essentially the same thing.
Yeah.
Now,
Some patients, either A, they don't mind, or B, like you said, if you wear hair really short to begin with,
yeah,
for us to cut it down with a zero guard
yeah,
fade
yep,
is not a big change for them.
yeah,
And just like you said, it makes it a little bit easier for
sure,
us.
yep,
And another common question I get from patients is, they want to know the difference between shaved versus shaveless.
yep,
And when I explain to them, that's all about the harvesting of the grafts.
yep,
And it does not have an effect in terms of placing the grafts, which is a
yes,
common question. Patients are concerned, well, is there a different success rate? Or is the procedure different in terms of the placement?
yes,
And, to that I answer, it's the same shaved
yeah,
versus shaveless.
yeah. There's a big problem in the hair restoration industry, and we see it with the consults. It's just this trust factor, you know what I mean? Because there's so many different techniques. And, I think there's a lot of misleading information where providers, and again, I get back to the sales people because I'm not into that style at all. I think the doctor, it's a medical procedure, has to do the consult, be in the procedure, and be involved in the post-op. It's going to be the best bet. That trust factor is important for us because, I mean, it's a big procedure. You just have to trust. We're saying that's why we do videos and why we want to talk to people and just say, get to know us a little bit better. Hear our
Right.
passion. You know what I mean? This takes like dedication, perseverance. I mean, endurance, skill, artistry. I mean, everything. Patients are misguided when they get information from people that are not at that level, have no clue what they're talking about with shaveless, to
Right.
make any comment on either extraction or placement. It's completely ridiculous.
Yeah. I mean,
Yeah.
if you're having a consult and it's not with a medical professional,
Yep.
you really need to ask yourself, is this person credible, and
Yeah.
do they have the experience to
Sure.
give you, accurate answers?
My father, who's really probably the best physician I ever worked with, just incredibly skilled with people. Before I started my private practice, I spent 3 months with him, and it was unbelievable. And he taught me like 5 main things, but one of the first things he said to me, he said, "Don't ever badmouth another physician, another clinic.
Mhm.
We all need friends. It doesn't do
Good.
any good. What the patients want to hear is information. They're actually consumers of information. And if they agree with you, then great." This is not a sales job.
Right.
This is what we have. This is bona fide, and these are the results. These are the reviews. It takes a lot to get to that level.
Yeah.
Yep.
I mean, to your point, we're not professional salespeople. We're physicians.
Yeah.
Just try and be truthful with patients. Highlight what makes us, a premier hair
Yeah.
restoration practice.
Yep.
And then they have the information to make an informed decision.
If you're exploring hair restoration and want a discreet, natural-looking option, we'd love to talk. You can learn more or book a consultation using the link below. Thanks for watching.